One of the worst things about a cough is that sometimes it feels like it can be caused by just about anything. But here's the question. Can the kind of cough that's bothering you give a hint to its cause? Is this just cold, allergies, or something else? I'm Shani, your friendly pharmacist, to answer some of these medical questions. This is the Good Doctor. We have two different categories of cough, the chronics and the acutes. Let's get introduced. Acute coughs can last up to 8 weeks, but over-the-counter cough medication can usually quiet them down. A dry cough that later turns wet and phlegmy with yellow, green, or red mucus.
I love coming to the Coffee Cabana. Let's dance. Ooh, they're playing our...
Could be a sign of pneumonia. This condition inflames the lungs and fills it with fluid and can be really serious. If you think you have pneumonia, talk to your doctor ASAP. There is a vaccine recommended for infants up to age 2 and adults 65 and over because they're most vulnerable to dangerous complications if they get pneumonia. Another type of acute cough is caused by a virus called pertussis, also known as a whooping cough. It's called whooping cough because if you have it, you actually make a whooping sound when you inhale. The good news is you can totally prevent this through a vaccine. The bad news is whooping cough is on the rise because people are skipping the vaccine. Come on, people. I mean, no one wants to get stuck by a needle, but wouldn't you prefer that over coughing till you puke? So those are some examples of acute cough. Not so cute, but other category is chronic coughs. These last 8 or more weeks and can have many different causes. Allergies, colds, and sinus infection can all cause chronic coughs. Chronic cough that comes with cold, allergies, and sinus infections can be dry or wet.
Nice.
These also tend to get worse at night. If you've got a chronic cough and you're not getting relief from over-the-counter medication, or the coughing persists beyond a week or 2, consult your doctor. They'll determine what further steps you'll take to stop your hacking. Plus, sometimes coughing could be a sign of something more serious like chronic obstructive pulmonary disease or COPD. This condition causes lung inflammation that constricts your airways, making breathing very, very difficult. It's usually caused by long-term exposure to lung irritants like cigarette smoke. This hacking cough creates a lot of mucus, particularly in the morning. Quitting smoking is one of the best things you can do to avoid COPD. Cut down on coughing or even just improve your overall health. People with asthma may also have to deal with coughs because asthma causes airway inflammations, swelling, and extra mucus production that makes breathing more difficult. Asthmatic coughs can be dry or wet and end with a rattle or wheeze. Often it gets worse at night in cold air or with exercise. Medications like inhaled bronchodilators or corticosteroids can be used by people with asthma for quick relief from coughing attacks. But sometimes medication themselves can be the cause of chronic coughs. This type of cough may appear a few weeks after you start taking a new medication. For example, 20% of patients taking medication called ACE inhibitors for high blood pressure experience a cough. The color of phlegm can provide some clues about the potential underlying cause of respiratory symptoms. However, it's important to note that while color changes can be indicative of certain conditions, They are not definitive diagnostic indicators on their own. Clear or white phlegm is often associated with viral infections, allergies, or normal mucus production. It can also be a sign of early-stage respiratory conditions. Brown or rust-colored phlegm may be due to presence of old blood in the respiratory tract. It can result from a variety of factors including smoking, environmental pollutants, or lung conditions. Red or pink phlegm is more concerning signs, as it may indicate the presence of fresh blood. This can result from a bleeding or injury in the respiratory system, and you should seek medical attention promptly. Gray or black phlegm may be linked to exposure to certain environmental toxins such as coal dust or heavy pollution. It's important to address the underlying environmental issue and seek medical advice. Different types of coughs require different cough medications. Antitussive, these are cough suppressants that help reduce the urge to cough. They are often used for dry and non-productive coughs. Expectorant cough medications are designed to thin and loosen mucus in the airways, making it easier to cough up. Guaifenesin is a common expectorant used in many over-the-counter cough syrups and pills. Mucolytic agents like acetylcysteine work to break down and thin mucus to make it easier to clear from the airways. These are often used in conditions where sticky mucus is a problem. Some cough medications contain antihistamines like diphenhydramine or chlorpheniramine. This can help relieve coughing caused by allergies or post-nasal drip. For more questions, please comment down below and hit the notification button for more updated videos. See you next time!
To proceed with free online consultation, click the link in the comments section.